Hi everyone, the title of our talk is Implications of Choosing Different Imputation Methods while Inferring About Per Protocol Effects of Sustained Treatment Strategies. And this is a work done by myself, Ehsan Karim, and Belal Hossein. We are both from University of British Columbia, School of Population and Public Health. For pragmatic trials, not addressing incomplete adherence can lead to biased treatment effect estimate. Sophisticated statistical methods such as inverse probability of adherence weight estimators are gaining more recognition and popularity in the per protocol analysis due to their ability to address adherence. The strength of this method lies in the utilizing high quality pre and post randomization factors in the analysis that can predict the adherence pattern and appropriately adjusting those factors in the analysis via inverse probability weighting. However, infrequent measurement of the post-randomization factors can threaten the validity of this method. Due to cost and logistical constraints, more frequent in-person measurements of necessary factors may not always be possible to schedule in the trial design, leading to possible gaps in the longitudinal measurements of post-randomization factors, resulting in suboptimal estimates. This type of data sparseness could be considered to follow missing completely at random pattern. As an aim, we have considered two imputation methods, last observation carry forward and multiple imputation, to impute values of the months where measurements of any post-randomization factor were not recorded. Based on Young and colleagues' 2019 trials paper, we have simulated datasets with a survivable outcome. We considered bias, standard error, mean squared error, coverage, bias eliminated coverage, zip plot as measures of performance. Based on our simulations, here is the summary of our findings. When there does not exist any confounding, the statistical properties of inverse probability of adherence weight estimates from either imputation method are desirable and similar. The same is true when there exists confounding, but all of the necessary confounders are measured and adjusted. However, bias level from both approaches increase with the increment of the gap in measurement frequency. When there exists an unmeasured baseline confounder that leads to treatment confounder feedback. Last observation carry forward approach showed better coverage probabilities compared to that of multiple imputation, particularly when the variance of the post-randomization confounder was low. When the variance of the post-randomization confounder was slightly higher, bias levels, coverage probabilities, and zip plots from last observation carry forward did not have any noticeable advantages in terms of statistical performances compared to those from multiple imputation. However, such an advantage would diminish as soon as the variability in the post-randomization prognostic factor increases. When the trial sizes increased, the coverage probabilities were drastically reduced. We were primarily interested about predictive mean matching when we were imputing the observations in the multiple imputation approach. Given that there exist many imputation methods, we also used a number of other imputation methods within the multiple imputation approach. The results were generally the same. In our main analysis, we have estimated odds ratios as well as risk differences, and the statistical performances from simulations for both of these estimators remain the same. Thanks for your interest in our work. Feel free to communicate with me if you have any further questions.